My name's Jackie and I'll be doing this, and it's for education purposes, so hopefully we'll get all the information that will help both you throughout your pregnancy and for our medical or midwifery staff that use this as a really important just to empty your bladder, only because it can make it very uncomfortable when we do the assessment, and also sometimes it can lift the uterus up a little bit higher and make the assessment a little bit unusual, or make the uterus appear a bit larger than what it is. Have you brought your antenatal card today?
Yes, I
great.
have, yeah.
It's always really important that we have a complete and up-to-date antenatal card, and we rely on our doctors and our midwives to ensure that that's complete.
Mm-hmm.
So we document all sorts of information on that, and you'll notice along that card we have parts where we talk about how many weeks pregnant you are. We measure the fundal height to see how many centimetres the pregnancy is measuring in the abdomen there. We also monitor movements, the baby's position inside the uterus, whether you've had good movements, and we might document things about your blood pressure, your urine, and also any management plans that we might have onto the side. So we rely on our medical staff to ensure that that's up to date and complete. Does that make you today?
Just over 26 weeks.
Beautiful. What a lovely time. What number baby is this?
First.
Okay. Generally, we're measuring fundal height from around 20 weeks up until term. One way that we do that is we measure from your xiphisternum, which is this bone here. We're just going to feel down to the xiphisternum just here. We're going to run our fingers just very gently until we can find the top of the fundus. And that's this little arch section, which is the top of the uterus. Mm-hmm. So we measure the height of the fundus from the top of your pubic bone. So I'm just going to have a little feel for your pubic bone,
sure,
if you don't mind. I'm just going to feel just to the top ridge of that pubic bone. We're just going to measure up and over your tummy to the top of the fundus, and I'm going to just roll my fingers in over the top of the ridge here of the fundus. I'm going to measure where my middle finger is. So you said you're 26 weeks, so let's see. Beautiful, 26 centimetres.
Mm-hmm.
Is there any tenderness or anything when we're having a little feel of your tummy? So it's always good to have a little feel to make sure there's no unusual lumps and bumps, and it's always good to ask whether you've had any previous surgery. No surgery?
No surgery.
There's no scars, no obvious signs of any trauma, accidents, no burns, no unusual. So it's always nice to observe for any fetal movements while we're doing this. Okay, so I'm just going to use the flats of my hands, and I'm just going to feel the top of the uterus here, and I'm just going to have a little feel and see if I can identify the position of the baby at the moment. When we're doing it at this gestation, it's not as important whether the baby's lying with its head up and down or across. They still have quite an area of room to move. It's quite common that they would actually be breech at this time as well. We have something sitting here. Feels a little bit like a head. I think we have a bottom over here. So we're able to, if we move the bottom, the whole baby actually moves. If we were to move the head, we find that the baby's head bounces between our fingers a little bit easily. So if we were to have a look, we would normally find on a first time that because you have much better abdominal muscles, the shape of the uterus will be more in this direction, so it's a little bit more like an oval. Once you've had babies and the abdominal muscles are a little bit more relaxed, sometimes it can be a little bit more round. You often will find though that the fundal height will be influenced by whether there's one or two babies in there, whether you've got a particularly large baby or a small baby, and for the amount of fluid that's in the uterus as well. Can I ask you about your movements? What sort of movements have you been having?
Lots of kicks and turns and tumbles and all sorts of movements.
So when the baby's in an active phase, you'd be having more than 10 movements in a 2-hour period?
Yeah.
And that would be considered normal movements at any time in your pregnancy. So, but if you have any concerns with any of your movements, the first thing you can do is either contact your GP, but you do have your, on your antenatal card, you have the birthing unit and the hospital's phone number, so you can contact the hospital at any time. We've got someone that will talk to you and guide you through. So it's really important for us always to listen to the baby's heart rate when you come for an antenatal visit. So we've worked out that the baby's head is in this location, and we're feeling that its back is going around this way, and it's got its little feet kicking this direction. So if we were to listen to the baby's heartbeat behind its shoulder, we should expect it to be right there. So we'll just get the Doppler and we'll have a quick listen to that. We just use a little bit of gel. It's just a little bit cold. And we'll have a listen to our baby. And there it is. So what we're listening for, we generally listen for a minute. We also listen to the rate, so we're expecting the heart rate to be somewhere between 110 and 160, and it's wriggling around when I watching there. And we're looking for whether it's consistent, whether it's within the normal range, and it's always reassuring for yourself to hear that. So it's around 148 beats per minute. And just on a side, I'd get your mobile phone out and just record it. So everything looks beautiful with this pregnancy so far. At 26 weeks, baby's growing nicely. It's meeting what I would expect the baby to be doing at this time. Baby sounds lovely. So good, nice, strong heartbeat. So I'm going to document that on your yellow card, and we will see you in 2 weeks' time. Great.
Thank you.
Thank you. Okay. So we just have a little look at your tummy. The first thing we do is just have a look to see if there's any marks, any striae, any linea nigra, the line that goes down the middle, any scar tissue. Have you had any surgery in the past? If we were to look at your tummy, being a first-time mum, you have really good abdominal muscles, so we tend to see that the uterus sits in a lot more of an oval shape. When you have subsequent babies, often the muscles relax a little bit and the abdomen can look a little bit more on the round side. It can also be affected by the position of the baby, how many babies you have in there, the amount of fluid that's in there, and obviously the size of the baby. So we're going to measure from the top of the symphysis pubis, which is just this little bone down here. I'm comfortable. Place the measure tape there, and I'm going to feel to the top of the uterus. So it's the curved area at the top of the fundus, and I'm going to use my middle finger there just to identify the top of that area there. And we look, and we're looking at 35 and a half weeks, so that's beautiful. Excellent. And have you had an ultrasound recently?
Yes, I have.
Yeah. How many weeks were you then?
34.
And everything was well with that ultrasound?
Yeah.
So there's many things that we can pick up from those measurements. Generally, we're measuring fundal height from around 20 weeks up until term. So at 20 weeks, we expect you to be at least 20 centimetres. 34 weeks, we can expect for you to be measured at 34 centimetres. If we notice that the measurement is 3 centimetres out, so larger or smaller than what we're expecting, I need to be thinking about whether your baby's growing within its normal range, whether there's extra fluid on board that might be impacting that, and I need to be thinking about diabetes, high blood pressure, anything that can cause abnormalities. So what I'm going to do, Sasha, now is we're going to try and work out which position this baby's lying in. So whereabouts are you getting most of your kicks at the moment?
It's been over here mostly.
So sometimes that can give us a clue. If it's kicking with its little hands and feet over here, we might find that its back is down this side. So let's have a little feel. So we just use the flat pads of our hands, and we're going to start from the top and see if we can find a side that has more resistance to it than the other. Certainly feels like we've got quite a firm section across here. Let's have a look on the other side just to see whether we can feel any limbs or bits sticking out. You can feel my fingers going in a lot further on this side. So I would say that we have a bottom sitting right here, and I can put my hand on either side of it, and when I wriggle that bottom, the whole baby moves. Can you feel that baby moving? Yeah, sorry darling.
That's fine.
So we've got the baby's back going down this side. And then what we're going to do, we're going to have a little feel for the baby's head. So I generally look down at your toes and I bring my fingers down each side of the abdomen like this. And we start from about 10 centimetres above that pubic bone. And so just take a deep breath for me and try and relax when you breathe out. It's most definitely your head sitting down there. I'd say that it's not quite engaged just yet. There's a little bit of the baby's head still well above the bones of the pelvis there. The other way that you might find the midwives do it, certainly in labour, is take that deep breath again and breathe out. And we're going to do it from this direction, and we can feel the head. And I can feel that head just moving from side to side. Can you feel, have you ever done that?
Yeah.
Have you done it? Just put your hands on either side there. Push those fingers in and just see. Can you
it's amazing.
You can feel that baby moving from one side to the other. Yep. So if we're saying baby's back's here, our bottom's here, back's down along this way and its head here, we generally listen to the baby's heart rate behind its shoulder. So we would be expecting to listen in this position just here. So let's see if we're right. So So we're just going to use the Doppler. I'm going to listen to the baby's heart rate. So we generally listen for about a minute. When doing the fetal heart rate, it's important to determine what the maternal pulse is as well. This is to ensure that we're not detecting the maternal heart rate instead of the fetal heart rate. So we generally expect the heart rate to be between 110 and 160 beats per minute. And we're listening for how fast it's going, the consistency in the heart rate. And we need to listen at every visit for the heart rate. It's beautiful. And you'll find when your baby moves, its heart rate will go up, the same as if you were to walk up a hill and your heart rate would increase with the exercise. So when a baby does a movement, its heart rate goes up as well. Same as when it's sleeping, its heart rate can just settle down for a little while and it doesn't change as much. Okay, Sasha. So from this abdominal assessment, we've been able to determine quite a few things about your baby. First of all, that the baby's lying in this longitudinal direction. It's got its bottom up here, its back around this side, and its head down here going into your pelvis. We've listened to the baby's heart rate, and it's beautiful and strong and regular. We've been able to determine by measuring the fundal height that it's equal with the amount of weeks pregnant you are, which is a reassuring sign for your pregnancy. You've had a normal ultrasound at 34 weeks, which showed normal growth, normal amniotic fluid index, which is the amount of fluid that's around your baby, the normal systolic diastolic ratios, which is the way the blood gets pumped through the baby's cord, and that it's within the normal centile band, 65%, which is perfectly normal for this gestation, which are all really positive signs.
Excellent.
So thank you very much for doing that, and we will see you in 1 week.
Thank you.
One of the challenges that we face is that women who are presenting with high BMIs are more difficult to palpate, where it's difficult to determine fundal height, it's difficult to determine fetal position, and often we need to do increased fetal surveillance using ultrasounds. So generally, in summary, we always perform hand hygiene before and after patient contact. We explain the procedure of the abdominal palpation to the woman, and we gain permission to commence the procedure. We prepare the woman, making sure the woman has emptied her bladder. We need to position the woman in a semi-recumbent dorsal position on the bed or bench. The woman should be encouraged to lie with her arms by her sides to aid relaxation of the abdominal muscles. Consider placing a wedge or a rolled towel under the right buttock if the gravid uterus is of a size likely to compromise maternal and or fetal circulation. The pelvic tilt prevents the occurrence of supine hypotension, resulting from the weight of the gravid uterus obstructing the inferior vena cava, reducing venous return and hence cardiac output. We do a visual examination. We estimate the gestational age based on the fundal height measurement with a tape measure. Obesity has been shown to distort the accuracy of these measurements. If when doing the fundal height measurement there is a 3 centimetre discrepancy between the gestational age expected and the centimetres in measurements, one should be considering further fetal surveillance to determine fetal well-being. We undertake a palpation, auscultate the fetal heart rate, do an amniotic fluid estimation. We ensure we document our findings and refer to the obstetric registrar at the hospital or the staff specialist if you have particular concerns.